Magandang hapon po sa lahat. I will be starting in a few minutes po. Maraming salamat po. Hello po, magandang hapon po sa lahat. We're going now to start our program. So once again, welcome to the Amidst, a webinar joined by the Division of Agusan del Norte and the Division of Surigao del Sur. To start with, I would like to recognize our partners, different divisions, the Division of Cotabato, the Division of Bukidnon, the Division of Agusan del Norte, and the Division of Surigao del Sur. Request everyone to please be at and to be followed by the national anthem.
Pamigib, tolangin, adoy bulan, ikaw ang nagbuhat sa katunan, ikaw kalibutan, manama, mawantok ka, warpoko iling koy ko. O Diyos, kahipulungan ka, busa ikaw lang ang simbahon ko.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم فقال ربكم ادعوني أستجب لكم آمين يا رب العالمين الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين ربنا إنك أنت الوهاب ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار وصلى الله على خير خلقه سيدنا محمد وعلى آله وصحبه وسلم سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين آمين يا رب العالمين.
In the name of the Father, Son, and Holy Spirit. Our most gracious Heavenly Father, we come to you today to praise and worship you and give you thanks for all the things you continue to provide for ourselves and our families. Father, we humbly ask for forgiveness for all the times we have offended you. When we forget to acknowledge your presence in the midst of our brothers and sisters, and for moments we fail to be good stewards of the blessings you have given us. Continue to guide and protect each one of us, Lord, that we may always walk in the light of your everlasting love and mercy. Grant us, Father, with your comfort in times of distress and with your strength in times of weakness. Bestow upon us your unending grace and healing, that we may in turn become instruments of gentleness and compassion to others. We ask all this in the name of your Son, our Lord Jesus Christ, with a prayer and in Amen.
Manama, mawantok ka, warpoko iling koy ko. O Diyos, kahipulungan ka, busa ikaw ikaw lang ang simbahon ko. Musa ikaw lang ang alagaran ko. Oh.
So, ayun po, once again po, good afternoon everyone. We are very happy, no, knowing we all have 500 participants in Zoom, and also we are also live in Facebook. Just search for Accord Incorporated. We also have here as of the moment, we have 622 live viewers po ng Facebook. In the meantime po, kindly answer the poll so we'll know the divisions represented today. So ito po yung poll, kung nakita po ninyo, from what division office are you? There you have it. There are already 300 out of 500 who answered. So there you have it, our dear participants. We have 98% of our Zoom attendees are from the division of Surigao del Sur, and we also have attendees from the division of Agusan del Norte. A round of applause. So, reminder po sa lahat na tayo po ay nasa webinar mode and your microphone are automatically turned off. Again po, ako po si Melay mula po sa Accord, and we would like to welcome everyone to our Reach to Teach Mental Health and Well-Being Amidst COVID-19 Pandemic a webinar. At this juncture, to know more about what is this webinar all about, I would like to call on the Deputy Consortium Coordinator for the Reach to Teach project. Ladies and gentlemen, let's all welcome Ms. Elizabeth M. Valmoria.
Hello, mic test. Madunggan ra. Hello, maayong hapon. Okay. Okay, good afternoon, everyone. For our participants from Surigao del Sur and Agusan del Norte, good afternoon. To our facilitators and my colleague, good afternoon. This activity this afternoon is part of our preparation for the upcoming opening of the school year 2020 2021. The Reach to Teach project, in partnership with the Department of Education, Surigao del Sur Division and Agusan del Norte Division, aims to contribute to the need for sup- psychosocial support and well-being of our teachers and DepEd personnel to ensure that we are more empowered as educators to support the psychosocial well-being of our learners. We hope that this webinar will be of help to our educators as we continue to serve our students in the midst of this COVID-19 pandemic. Um, Let us all enjoy and have a good time during our webinar. Thank you. Back to you,
That was
Melay.
the Deputy Consortium Coordinator for Reach to Teach project, Miss Elizabeth M. Valmoria. Before we proceed, may I request all the participants to please type in the chat box your name, office, designation, and the actual location as of the moment. This is a special webinar we are doing in partnership with the Department of Education, Division of Agusan del Norte, Bukidnon, Cotabato, and Surigao del Sur. At this juncture, ladies and gentlemen, to give us the welcome message, ladies and gentlemen, let's all welcome the school's division superintendent of the Division of Surigao del Sur, Miss Josita Carmen.
Good afternoon, Milay. Can you hear me?
Yes, Miss Joker, loud and clear po.
Okay. Good afternoon, everyone. I'd like to thank our Reach to Teach partners and Accord for this opportunity to be able to enrich our knowledge on mental wellness. I'd like to thank also the PSDSS who convinced our teachers to join this webinar because this is really the need of the times. And so my thanks really to all of you there, no? This is really very timely because just yesterday our governor was diagnosed positive with COVID. And so there was this panic reaction, anxiety, and even bordering to hopelessness. Even our own division driver, who is in contact with me, and I had a contact also with the governor in our inauguration of our Simuao and Loknodon IP schools, no? Uh, they were apprehensive. They were afraid that they will also be infected. So yesterday, it was really some kind of it was doomsday, no, for them because they were anxious what will happen to their families, and so when one of the personnel whom I had contact with for a long time last weekend had a negative rapid test result, there was there was a sigh of relief. But then this pandemic really affects us whether you are poor, rich, powerful, or powerless. This is a reality that we have to accept. And so our reaction to any situation is brought about by our mental models. How do we react to this kind of situation such that even in an insane situation, we manage to have sanity? So here, this webinar will really be of help to all of us. And I am thankful, and I hope that you are taking down notes, our listeners, our joiners of these webinars, and that we will be able to apply what we have learned here. Okay, so here's to a productive, enjoyable webinar to all of us. Good afternoon, everyone.
Ladies and gentlemen,
Yun lang,
Yes, ma'am.
guys.
Ladies and gentlemen, that was the school's division superintendent for the division of Surigao del Sur, Miss Josita Carmen. At this juncture, we have our another poll. I would like to ask the teachers to please click in. How are you feeling today? So let's see how does our teachers are feeling today. Okay, there you have it. Uh, we have the result. Most of our teachers and our attendees are feeling excited. We have 43% feeling excited. Another 43% are happy. 7% are beautiful, of course. We are all beautiful. And we also have 4%. Some of our teachers are emotional. Without further ado, uh, also have our partners joining us in this webinar to give us a message. Uh, Let us all welcome the program manager from CARE Philippines, Miss Anche
Hi,
Talavera.
Melay. Hi, everyone. Magandang hapon po sa inyong lahat. Yung iba po ay nagkita-kita na tayo sa ilan pa nating mga webinars sa Real Hub. Most recently, yung ating camp coordination and camp management. At marami ring teachers yung nakasama doon. Ngayong hapon po, natutuwa kami na makita na nasa 500 participants tayo sa Zoom. At kung tama yung last check ko kanina ay nasa more than 1,000 na po yung ating nasa FB Live. So maraming salamat po sa pagdalaan ng hapon ninyo kasama natin dito sa ating webinar. Mula po sa CARE, sa Accord at sa ating pong funding partner na European Commission Civil Protection and Humanitarian Aid, kami po ay natutuwa na patuloy na makapartner ang Department of Education at ang iba-ibang divisions po. Ngayong hapon kasama natin ang Division ng Agusan del Norte at Division ng Surigao del Sur. Gusto po naming ipaabot yung pag-accord ng Save the Children at ng ECHO doon sa very evident na steadfast na commitment ng ating Deped, ng ating mga teachers para ma-ensure yung continuity ng learning sa gitna nitong pandemic na patuloy nating nararanasan at hindi lang yung pandemic, marami tayong ibang kinakaharap pa ng mga disasters at increasingly complex yung mga risks na kinakaharap natin at tinitingnan natin na napakahalaga ng continuity of education para doon sa ating mga learners. At gusto rin po naming i-reaffirm yung aming commitment sa pag-support po sa ating mga teachers, sa ating mga eskwelahan, para sama-sama nating mapagtulungan na patuloy na makapag-provide ng safe at quality learning para po sa ating mga learners. And as such, dahil ganito yung kinakaharap natin sa ngayon, nakikita natin na very relevant itong ating webinar ngayong hapon on mental health and on psychosocial. And we wish everyone a productive afternoon of learning and reflection at sana po ay ang mga practical lessons na matututunan natin ay mai-apply natin pagbalik natin sa ating mga gawain sa eskwelahan at kasama yung mga estudyante. So ito lang po. Maraming salamat po ulit at magandang hapon sa inyong lahat. Back to you,
Ladies and
Melay.
gentlemen, that was the program manager from CARE Philippines, Miss Anche Talavera. Thank you so much, ma'am. At this juncture, we would like to introduce our speaker for this webinar. He is a faculty from the Department of Professional Education in Mindanao State University, Iligan Institute of Technology. He graduated BS Psychology and Masters in Psychology in University of San Carlos and his PhD in University of Santo Tomas, summa cum laude. As a researcher, He was the director of the Universidad de San Jose Center for Psychological Research and Practice. He also authored a book entitled Case Management and Procedures, which has been reprinted and used until now by UST, FEU, and other schools offering graduate studies in psychology and social work. He has extensively published and regularly reviews studies in different ISI and Scopus Index journals. Currently, research interests of him include positive education, teachers' well-being, peace education, and mental health issues and concern. As a clinical practitioner for more than 2 decades, he helped develop several therapy centers funded by known international funding agencies. As an academician, he taught in University of San Carlos, University of Santo Tomas, and Universidad de San Jose in Macau. He conducted several trainings and workshops on mental health and psychological well-being here and abroad. He is currently teaching in Mindanao State University, Iligan Institute of Technology. Ladies and gentlemen, our speaker for this afternoon, Dr. Emilu G. Mordeno.
Good afternoon. Um, I am happy to be here, and I will be sharing to you some um, knowledge I have with mental health. And as a clinical practitioner, I will also probably provide you with some interventions or tips, basically, on how to cope effectively with this pandemic. Okay, so I'll start with my PowerPoint. Is it okay, Melai, to start with the PowerPoint presentation already?
Yes, sir. Yes, sir. Go ahead. You can share your screen.
Okay, a while. Can you see the PowerPoint presentation now?
Yes po.
Okay, so I'll start. Once again, oh, sorry. Okay. Once again, good afternoon, maayong hapon. Um, I am Dr. Mordeno. I'm Emilio Mordeno. I'm a clinical psychologist by profession. At the same time, I'm a full professor in Mindanao State University, Iligan Institute of Technology. So, my talk today evolves around another impending crisis. You know, sometimes we call this a crisis within the crisis. We had the crisis right now, which is actually the COVID-19 pandemic. However, um, according to extant literature, no, with regard to epidemiology, um, if the population is already suffering, I mean, the proportion of the population from 8 to 12%, if they are suffering from a certain disorder or a certain disease, most likely that can already be considered as epidemic. No? So we will try to look into uh, not really a creeping epidemic, but somehow an inevitable crisis that we may likely to have probably during this pandemic or even no, after the pandemic. Okay, so um, my first activity, usually because I wanted to have an interactive session with the participants, although I would assume that some of you may already have some knowledge pertaining to psychological health, but this is also a community service, actually, in part, in our part, to assess, right, the mental health condition of the participants here. Now, I have to tell you honestly that the report that will be generated from your results are templated based on the manual or validated psychological tests that we will be administering. Okay, this is for free. No, We have been doing this for a number of seminars already, and I guess the participants were quite appreciative because of the fact that we automatically, after you will respond to the set of scales that we will be sending to you, you will be given an email pertaining to the results of the psychological test. And we also provide some suggestions. If you have this score, what will be the most effective way of dealing or coping with certain probably elevated scores of some mental health disorders. Okay, so what are the advantages in you know answering these tests? Number one, a personal awareness on your level. No, so the mental health that we are talking here is not something that is just actually a byproduct of life experiences, but this is really actually particular to the COVID-19 pandemic situation. Second, it provides a data on the mental health of teachers, no, and teaching professionals, no, which could be the basis for policy development, right? So if you will answer the scales, and we will, of course, we will collect the data. We will create some sense out of the data within this lecture, because automatically it will be computed here. And then I will present to you so that you can have a sense of what is the prevalence of our mental health condition here in this particular part of the world. No, and I will be giving you some discussion later. Okay, that will be the source of our discussion, and all those things. No, now after answering the scales, no, a templated interpretation will be sent to your email. The results should not. I mean, this is significant to note. No, the results should not be considered as diagnosis, because you need actually interviews and other collateral sources of information rather, in order to have some diagnosis with regard to your mental health condition. This is just for self-awareness. No, meaning to say, in clinical psychology parlance, we usually um, uh, label this as provisional diagnosis or probable diagnosis. And this will definitely help you a lot. Okay. Now, this is an anonymous survey. Okay, you don't have to put your name. If you are not comfortable putting your name, you don't have to put your name, but you have to put your email ad, no, so that we could reply to you the interpretation. No, the interpretation will be given uh, at probably, if you will be within the 1,000 um, 1,000 respondents who will, not respondents, but participants who will be taking the exam. First 1,000, you will be given automatically the results. I guess minutes after you will have your after you will finish or you have completed actually the exam. And then for those who will be exceeding the 1,000, you will be given tomorrow the results, because Google form limits only to 1,000. But we will make ways in order to receive for you to receive the psychological result as soon as possible. Okay. As what I have said, this is anonymous. So meaning to say, the moment we will send to you the results of the test, automatically our system will expunge, will obliterate your email. So meaning to say, we could no longer trace you. However, if you want to reply, you can reply to the sponsoring email. We can receive that, and then automatically your response will be confidential. No, so meaning to say, it will no longer be anonymous, but it will be confidential. Nobody will know except us. Okay, but if you will not respond because you might not feel comfortable, automatically your email will be expunged, and no personal information can be extracted from you. Okay. What else? If you are interested on reading basically the validity studies of these scales, you can freely ask us, because as a social scientist myself, I have published, I guess we could consider that extensively, on the validation of these scales. Now, these scales are not just um, uh, basically given to you without any validation. No? In fact, all these scales were validated, and most of the respondents of these scales, by the way, are coming from Mindanao. No? So far, as what I have said, and I'm very thankful to Accord. Um, this will be the first time that an assessment packet of scales will be given to participants in a way. Uh, and the first time in this probably disaster where it will be given to you automatically, and the scales you are assured that these are validated. Again, if you are interested, these are the journals that I co-authored or main authored with collaborations coming all over the world and other universities also in the Philippines. And you can review that probably if you are very much interested on the scientific journals or ISI index journals pertaining to the validity of the scales. Okay, so please copy the link, and Melai and probably my research assistant here, Mitch Ferulino, will give the link to the, shall we say, the chat box, right? And then answer that for the next 15 minutes. I will be back, of course, after 15 minutes of answering those scales. The moment you will answer, we can also monitor if you are if you have completed the scales, and automatically we will send back the results. Okay. If you do have some questions, please feel free to ask questions so that I could respond to you immediately. If you do have questions, please raise. Mela, if there are questions pertaining to the scales, you can moderate the questions, and then definitely I will respond that. I will respond to that. If there are no questions, so I will leave you for the next 15 minutes before we will start the proper lecture. Okay. Again, the results will automatically be presented also, not without any personal identifiers in this webinar. Okay, so far, I will be putting myself into mute, right? Melai?
Yes, yes, sir, copy. For our participants, for if you have some questions, you can see the Q&A tab in your Zoom account. You can always put in your question so that Dr. Mordeno can answer it live, or his research assistant, Mitch, can also answer your questions in the Q&A box. Link is already provided on the chat box, so you can always click on the link provided by Miss Michelle Ferrolino. Thank you so much.
Hi, hello. Hi, Melai. I guess we could start while some of them were still answering because some of our participants already have done with their scales. So, um, could we proceed with the lecture, Melai?
Yes, sir.
Oh, okay, thank you. Um, so, uh, here I would like to emphasize that this lecture is not about how will teachers handle their students. No, this might give you some ideas because colleagues of mine from Ateneo de Manila are actually giving a lecture about psychological first aid, right? um, Although I as a practitioner and as a scientist, although I adhere to psychological first aid, but in our first few run, first few run of giving webinars among teachers, it seems to me, it is my impression that the moment I gave lectures about psychological first aid, the reaction is what? It's like a little bit antagonistic because of the fact that they are also victims of this situation, no? Pandemic related situation. So um, I guess it would be better if psychological first aid will be given as a training to teachers, uh, but probably it will come after the understanding of how our mental health is affected by the pandemic related distress, no, so that we will also understand ourselves first before we can provide interventions to our students. Okay. um, so COVID-19 pandemic not only affects physical health but also mental health and well-being. And a lot of studies or increasing number of studies are saying that somehow it's not you don't have to be afflicted by the COVID-19 in order to feel the pressure, no? According to our madam superintendent, um, the anxiety is there, right? The fear is there. The fear of being afflicted by the COVID-19 is there. The being a witness of individuals who are afflicted, will also affect us as teachers. And in fact, teachers are vulnerable as a group, um, to experience a certain, debilitation in terms of mental health. Prior to COVID-19, research would say that teaching is one of the most stressful profession in the world. Can you imagine if that is the global scenario? That this is according to OECD. No, this is the global scenario. How much more that today we are facing a new reality, no? And this reality really drastically and disruptively change our system. For example, we change our pedagogy because of this. I have witnessed teachers striving to cope with the modular and blended learning. I have witnessed teachers who basically are, so much devoted to their students to a point where they have already pain in their bodies due to the fact that they need to give extra efforts, no, in order to successfully implement, their, or deliver rather, their lessons. It changes curriculum. This pandemic changed the curriculum, instructional programs. This pandemic basically changed the way we see things. The disruption of classes are there. The fear that in the blended learning that we may probably adapt or we may not probably adapt, is there because of our signal here, right? Online, internet signal. Yes, last week I gave, just this Monday, I was giving a talk, no? And then suddenly I was lost in the middle of the talk. Why? Because our signal here in Iligan became, very erratic. And then I learned later that it was PLDT, no? And then a month ago, I was giving a webinar uh, as invited by Philippine Science High Schools. And I was very much surprised. Why? Because I saw the number of respondents who attended my webinar. And then suddenly, only 14 were left. 14 participants. So I was shocked. And do I have to continue my webinar? Because they said that they had brownouts, no? And then, here in northern part of Mindanao, and so all of their signals were gone. Okay, so this creates worry. This creates anxiety. This creates fear. This creates uncertainty. Now, the experiences of teachers here probably, not probably, but certainly, in fact, may likely affect their mental health condition. And I have some clients who are teachers, right? And they are all already complaining. In the College of Education, for example, because in a way, I was being tasked to be the psychologist in the institute. Um, a lot of people suddenly retired, no? Early retirement, even in college education, tatlo na kaagad, no? Because they could not cope with the new reality. And that is sad because they are good teachers and they are still physically able. But of course, because of the pandemic, it created a lot of distress. Okay? Now, we are very much familiar with these terms: enhanced community quarantine. Every day we heard all these terms: enhanced community quarantine, modified enhanced community quarantine, general community quarantine, and modified general community quarantine. As of the moment, Iligan is modified enhanced community quarantine. I don't know in Surigao del Sur, no. Melay, are you is Surigao del Sur in MECQ or GCQ?
The Tandag, I think, sir, the Tandag is now in implementing MECQ. Am I correct, Ma'am Jokar?
Anyway,
Yes, sir.
so um, we are used to this one, but basically it's community quarantine, meaning to say we are, you know, strongly encouraged to isolate ourselves, strongly encouraged not to go elsewhere, strongly encouraged to wear a mask, wear face shield, and we are strongly encouraged to stay at home, right? Because it's in a community quarantine. Okay. Now, what are the sources of this stress? As what I have said, you don't have to be afflicted with the COVID-19 pandemic situation. Events ordinarily in our daily lives due to the COVID-19 pandemic creates somehow disturbance in our living. For example, sudden isolation. Before, we are so social, quote unquote social, we interact a lot of people. We are teachers, right? And most of the teachers really, and I have to tell you this, the most talkative group of profession, no, are teachers. Why is it that I have said that? Because my father is a teacher. My aunties are teachers. My several, my uncle is the former regional director of Deped in Cebu province. And the families I had, no, the Mordenos are actually from Surigao, no. They are teachers. And once we have reunion, they talk a lot, you know. They don't stop talking. So I mean, that's the nature of our profession. That also is a relief to our stress. But suddenly, there is sudden isolation. We were encouraged to stay at home. Can you imagine how this is stressful is that? How distressing is that? Teachers who are suddenly being isolated. No, it creates so much disturbance in our life to a point where, you know, um, it's really bothersome, right? Now, I taught in the graduate school here, and my students are coming from Deped all over the region. And yes, they have those experiences where they felt that a half of their life is being suspended, right? Because, teachers, we talk a lot. No? Kung walang klase, we still talk to our colleagues. Kung wala yung colleagues, we still talk to our neighbors. Kung wala yung neighbors, we still talk. When nobody is there, we talk to ourselves, right? So very nature of teaching, no? Of course, if you are a different person, of course, I respect that. Then there is also a drastic change in lifestyle. That drastic change of lifestyle is actually very true, specifically for those individuals who are used to a certain ritual of their life, no? A ritual in their daily life. Like, for example, before, one of my rituals actually in life is actually to during weekends I roam around, right? Just to relax my mind from research, relax my mind from clinical practice, and relax my mind from teaching. And that's a lifestyle that I had. But I am not. I mean, I don't. It does not have to be costly, right? But I usually roam around and I usually go from one place to the other. But now I am constricted by my travel, right? So it is really, shall we say, a pain in the ass, no? And then another source of distress is disruption of daily routine. You know, di ba? Uh, ako kasi, di ba, I was born with people surrounding me, no? Teachers basically, elemental basic education teachers. Disruption of daily routine. The teachers usually have routine, di ba? Uh, because they are most of them, not all of them, no? Most of them are very organized. And then suddenly, this daily routine change, no? And we are helpless because even if we resist, we are forced to change our daily routine because we could no longer go to schools freely. We are encouraged to work at home, and then the routine at home is totally, a mess. You know, sometimes I feel guilty, to be honest. I'm a father of five. No, I feel guilty because before, when there is a holiday, you know, it's just so. But now, if there is a holiday where my children will not be online, I felt so happy. Why? Because for me, I feel freed from the responsibility, no, of monitoring them, and I could not help because I'm also working at home. No, I could not help listening to them, no, listening to their teachers, listening to the way they interact with their teachers. And I am a teacher also, although I'm a college professor. Then it really mixes up, no. So yung family work family balance or work life balance ay totoo talaga yon, and I will discuss that later, no. And then changes in work plans, and that is true. Schedules are being changed. Before, they told us to open June, and then September, and now October 5. And now there are also rumors that for those people or those individuals under MECQ may likely extend, but I really do not know, no. But that's the idea. I understand even, the system in DepEd, no. Although I may not adhere to some of the policies, but I understand because all of us here are uncertain. We look for ways to teach still and continue education, but at the same time, we don't want to risk our lives. We don't want to risk our students. And yet we need to readjust and adjust and readjust the way we make plans in our work, right? And then another one is financial difficulties, and this is true, no? Specifically in this part of the world, financial difficulties. The husband lost their job, the wives lost their job, your sideline business is actually falling down, so on and so forth. And in private schools it's worse, right? For Deped who are regular already, well, we are paid, right? But for private schools, reduced time means reduced payment, so on and so forth. And these are your friends, no, in the profession. So basically it will really go down to the empathy that you will feel to them, no, for being paid so less already. I mean, we could not also argue against the private schools because, you know, they live by profit, they live by money, of the tuition, coming from the tuition fee, no. And then there is also draft shift or of routine or home activities. Ito talaga grabe, no. um, I do not know with the rest of the group, but if you have access to cable, my God, Netflix is becoming central to the lives of many. Netflix becomes, center to the conversations of the family. Not only Netflix series, but even with cable television, you know, uh, I, I, I hate I hate to I hate to listen to, uh, at before I hate to listen Korean language, right? But I could not help. My children are talking Korean already, and they were laughing and they were talking, and I felt out of place. So I have to learn somehow Korean telenovelas, and sometimes I enjoy, sometimes I get irritated. But anyway, I wanted still to be part of the family conversation, so I have to adjust, no? And then there is also uncertainty and abrupt termination of on-school activities, right? And I, for one, is also, that a victim of that, no? Because we have graduate thesis, then the postponement is really, uh, you know, devastating. And supposed to be we have graduation, and then suddenly the graduation seems to be out of nowhere, so on and so forth, because of the pandemic situation. And then there are also delays in work activities. That this can also be a source of stress. 'Di ba? I have a friend nga, Doc, talaga, no? Akong Bisayon, ha? Makasabot man ng Bisaya ta na, no? Oh, magbinisaya ko. I have a friend nga niingon gyud siya nga, Doc, na nakit na gyud ako ang kamot saka stapler sa module. Then ayaw pugsa na kung dili po nako pugson, madelay man ko sa kuong work, no? So that is very common here in this part of the Philippines. Delays in work activities due to the pandemic situation. Mahutdan pagigbala sa stapler. Unya mo palit pag sa books sa bookstore. May lag na bookstore nga available. Pagka ang like for example here in Iligan, ang bookstore closed diri 5 o'clock. Kaya ang curfew 7 o'clock. So they have to close 5 o'clock so that they will give chance to their employees to go home. Wala may public transport. Oh, 'di ba? It becomes a laborious, no? Laborious effort to really abide bala sa stapler somehow, no? And then here comes another source of distress, overwhelming news, information about the pandemic every day, no? And it causes basically a lot of disturbance in our lives, no? For example, no, kaning uh, GMA. Pag sugod nimo sa news sa GMA, wala may ABS-CBN, no? Except if you have cable or internet, no? Pag sugod nimo sa GMA, ang I guess 60 to 70% ang ilahang news is about COVID-19. Ano, we could not blame them, no? If you go to the social media, much more, no? So negative news in the mass media is also very distressing. Like for example, the news that our government local official is being afflicted by COVID-19. That is very stressful, even if you don't like to listen to that. You don't like to be affected by that news, but it's reality. And then suddenly you have this thought that if they could be afflicted by COVID-19 and they have already a social status and money to protect themselves, how much more kita ng mga teachers, right? So that is also um, a source of stress. And then here comes another source of stress. Ito talaga, transportation from home to work and work to home. Okay lang kung ang schools niyo is nearby your residence, right? Like me. But if you don't have, if you teach far from your residence and the transportation there is already bad before COVID, worse during COVID, worst if it is also raining while you are experiencing MACQ, right? You know, few years ago, I because I conduct and I do research all the time, I've been through around Surig, Agusan del Sur, no? Na pa may mga bukid diha, eskwelahan nga lagyo kay sa bukid. No? How can, I mean, this is really, it's a devotion, it's a call for you to teach, but you have also to think about yourselves, right? It's not selfishness, but it is actually self-caring, because the idea there is that if you don't self-care, how would you serve better? No? I mean, practical lang, no? And I guess this is what the lecture is all about. No? And then another source of stress, and this is actually true to our students even here, lack of personal space in the family. And I mean, all of these are actually experiences, right? But these are according to studies also. Huh? I reviewed, basically for this talk, I mean, to the series of talks I reviewed around 383 studies, because this is something that is new. Then lack of personal space in the family. And this is true here in the Philippines, this is true in Vietnam, this is true even in Thailand. This is also true in Indonesia. Why? Because we specifically if we are in the rural area or urban poor areas, we have to admit, no, urban poor areas. Pag andoon sa bahay, they are cramped into one, residence. And they are, okay lang yun kung 5 lang. Kung malaki, shall we say, 6, 7, 8, yeah, 4 or 5 of them are actually having online classes. The lack of personal space is also causing distress. No? And then according to reports and according to studies, another source of distress nowadays are actually family conflicts. In fact, in the Philippines, our domestic violence cases increased substantially. No? Prior to the pandemic, and now during this pandemic, it increased. In global prevalence of domestic violence, it also increased a lot. No? So it is disaster made from home, and disaster consequent of which is actually also the victims are at home. So family conflicts are increasing. Even without domestic violence, family conflicts are increasing. Why? Because this is, the first time where we see our partners eye to eye, face to face, 24 hours a day. Di ba? At tung una, mangluod ka sa imong bana, mangluod ka sa imong asawa, mutrabaho ka, pagbalik, marag mawawa naman ang pangluod. Di ba? Ilang lang na lang dayon. Niya ilablab, si tawag na to, ilablab na lang. But with the work from home modality, sige ra kag tan-aw sa imong partner, sige ra kag tan-aw pod sa iyang kagwapo or kagwapa, pero at the same time matan-awan man sad nimo ang iyang kapangit. Labi na ug ang batasan manggawas kay tungod, ma-amplify man siya because you kept on facing each other all day long. Right? So katong mga pangluod pa atong una pa nga milabay nga mga katuigan, mubalik. Why? Because he is the only somehow person whom you can talk to, and the children. No? Ug katong imuha mga gibluom nga hinanakit ato una, can you imagine, I have a client nga ilahang gidiskussan sa iyang asawa, and they really went to me, although we have online sessions, because they were talking about their relationships atong single pa sila. Uy, Ginoo ko. Ibalik karon na kasi naman sila katubang, no? So that can also be a source of distress, because family conflicts are increasing with the stay at home somehow, no? stay at home status, no? And then another source of distress, no? It's you are fortunate, no? You are fortunate if you don't have family conflicts. I mean, that's good, no? That's good. Another source of distress is physical inactivity. I yeah, I discussed, I also conducted webinar last, if I'm not mistaken, last Monday, in among PE coaches and trainers in here in this region also, last Monday, and the interaction in the chat were really quite good, because one of the sources of their distress is physical inactivity. According to World Health Organization, in which I will discuss later, we need at least 45 minutes to 1 hour exercise or physical activity, right? Where you will really lift your body, no? Lahi po ng physical activity niya. Nara mo sa katre. Oh, lahi po na siya. No? Dili lang tamang hisgutan ng physical activity nga naa sa katre. No? Kanang gawa sa katre, kanang mo lift gid ka sa imuhang lawas. Okay? So, another source of distress is difficulty managing time. Have you noticed if you are at home, suddenly you will just realize, hala, alas 6 naman di ay sa gabi. Oh, hala, alas 7 naman di ay. So on and so forth. When you are working at home, your schedule will become very dynamic, no, very fluid, and most of the time, because of that, you will have now difficulty managing your time. And another source of distress is unpredictability of the situation, the feeling that you don't know what will happen next. Most of my clients had that feeling. We don't know what will be the future. Yes, can you imagine what will happen by October 5, opening of class? No? Would it be successful or not? I mean, these are concerns. Now, what if suddenly in the blended learning, the online or the internet signal will become very poor? What will happen to our students? Diba? Yesterday, I was having an online class. No, the other day, I was having an online class, and I was really very passionate because my class is about research. So I was very passionate talking to teachers who were my students. No? They are all teachers in the graduate school. So while I was talking, and then I was very passionate to a point where I did not really notice if they were still there online or not. When I look at them, when I look at the screen rather, ay nawala na. So I didn't know, asa ko kutob nag-discuss nga ako na lang isa, no? And it's quite funny kay I have to call them back and then ask them if they are still online. And I have to repeat my lecture again. Because di ba, teachers, sometimes when we are so passionate, feel na natin yung pagtuturo natin, sometimes we are overwhelmed by this emotion to a point where suddenly hindi ko pala alam na nawala na yung students kasi nawalan sila ng signal, no? So that is really a source of distress, no? And then another source of distress is interaction with students. And since you have not begun yet your classes, I will tell you, since we already started our class here, it's really stressful, no? Kasi nagtuturo ka, then you're interacting to your students. And then suddenly, mawawala sila. And it's not their fault because their signal is really poor. Bumabalik na naman sila, nawawala naman sila. Sometimes I have this thought, baka excuse lang nila yun, lalo na pag may, school work or class work. But I would rather be on the side of cautiousness, not to think about that. I guess this is, I implore you, as teachers, to really be very understanding and to be very patient. And that is also a source of distress, right? Kasi, nawawala lang talaga. Nawawala, bumabalik, nawawala, bumabalik. So you kept your instructions, there. That's why, as what I've said, and I have had a conversation with another faculty, pre-recorded lectures is actually, inevitable because of the signal, no? So that is another source of stress, no? Interacting with students that suddenly, and mind you, there are students whom you interact during online class, And then suddenly, you could not understand what they are saying because it's like naaba sa sulod bitaw sa kaning book sa nitawag na to na jar nga dako nga murag ana-ana lang. It's because of the signal, no? And it's really stressful. Another one is access to health and hospital services, and this is very true. Some of our hospitals now are overwhelmed with COVID-19 patients, and access to their health services is quite fearful at the same time and unavailable most of the time because of the fact that they are now overwhelmed with the COVID-19 patients. I mean, lalo na dyan siguro sa Surigao del Sur or Agusan del Norte, no? My sister is a doctor in the provincial hospital in Agusan del Norte, medical doctor, and she's a frontliner. And it's a sad story there, right? Because the resources are limited, and yet um, they have to be there, no? And then another source of distress is fear of virus transmission. All of us had this distress, right? Pagpunta mo ng grocery, sino kaya ang may COVID dito? It's in your mind already, right? It's there. Kasi hindi natin alam talaga who are carriers, lalo na yung mga asymptomatic. And that is really a source of distress. No? I usually buy, for example, in 7-Eleven, and then suddenly I felt na, ala, baka meron diyang uh, COVID na carrier, no? And then suddenly you will feel bad, okay? And then another one is, yes, so, oh, for a while. Friends going out of jobs. That's another source of distress. Ang dami nating source ng stress na eh. Friends going out of job. Relationship and interaction with work colleagues. And that is true as what I have said. And that is most stressful among teachers. Kasi as teachers, a professional group, we are talkers. We talk a lot. If not from our students, we talk a lot to our colleagues. Now suddenly, the school is like an empty or ghost school, no? When I roam around these days and I go usually to schools where I am a consultant psychologist, suddenly I felt lonely. Kasi yung mga schools nila, ang lalaki ng mga building, walang mga tao, mga security guard lang at saka janitors or janitress, no? And it's really sad. It's a sad scenario. And then you have also unfinished office-related tasks, ay lalo na sa Deped. I could understand that in CHED, they are very much distressed about that. How about Deped? Lalo na yun. Di ba? Before nga COVID, nagrereklamo na tayo. How much more ngayon na COVID na? No? And then, this is another source. Use of online applications. Okay lang sa mga teachers na younger ones. Okay lang siguro they could immediately adapt, to teachers who are younger in terms of age and who are actually coming from computer generation. How about those, na wala talaga? And this is becoming very stressful to them, no? Or even the younger ones who are not really into techie, into technological, shall we say, technological updates, no? Okay lang siguro si Melay, kasi Melay is always on the Facebook, no? So, that's the idea, no? It's a source of stress. And then another one is lack of financial and material resources to implement remote learning. And this is a very big problem in our part as teachers. Now, for example here, we need to have a computer. We need to have, in tertiary education, we need to have a computer, right? Ngayon sa Iligan, walang available na computer. Why? Because naubos lahat kasi online class lahat. So this is really a source of stress. Aside from that, how about yung presyo ng laptop biglang tumaas? Even surplus ng mga laptops and computers, they are now as expensive as the brand new nung una pang na price before COVID. But we could not do anything because, as teachers, we need to update ourselves. And it's a source of stress. So, in short, The pandemic situation, even if you are not afflicted, it affects your mental health condition. And according to research, and I will present to you in the next few slides, this becomes a crisis within the crisis. Now, I understand that the government is so much focused on how to lower down the transmission of COVID-19. And I guess that is very important. But we have also to be cautious. That's why I'm very happy uh, with the sponsorship of Accord, that this has to be discussed. No? I mean, mental health has to be discussed, because health without mental health is not health care at all, right? Mental health, health is with mental health, not only physical health. Of course, if physical health is also very important. So, ano yung impact ng COVID-19? Now, there are two dynamics yung impact ng COVID-19. The first one is the experience of pandemic-related distress creates a debilitation of one's mental health. Meaning to say, nung prior sa COVID-19, okay ka pa. Your mental health is very fine. Then COVID-19 sets in, and then you develop symptoms because of the different sources of psychological distress. So, ang mental health is become a byproduct of the pandemic-related situations or distress. No? Noong una, okay ka pa eh. Ngayon, hindi na. Medyo may mga symptoms ka na. And I will talk to you about that later. Okay? And another mechanism of pandemic-related distress or the new normal right now is that you have already a mental health condition. You already went to a doctor, meron kang depression, and then the COVID-19 pandemic came in. And it exacerbated, it increased the severity of your pre-existing condition. Meaning to say, you have already a mental health condition, and it increased a lot because of the COVID-19. No? So, kailangan natin malaman yung dynamics na yan. Are you already in medication? Hindi ka ba nakakatulog prior to COVID-19? Pagka COVID-19, lalo ka nang ayaw mo nang matulog talaga. So, that is a pre-existing condition. And we have to take note of that because, you know, to be aware even of our mental health is already very helpful. No? According to studies, the awareness itself of our mental health condition is already 30 to 40% therapy, no, to our disorders. No? So, what are the pandemic-related distress? Okay. Do you have questions as of this moment? Melay, are there questions? Hello? Melay?
Yes, sir. Yes, sir. So far, sir, wala pong questions. Wala
Okay.
pong nakalagay na questions sa Q&A po. Thank you
Okay.
po.
Okay, sige. Now, what are the pandemic-related distress? Ano yung klaseng disorders na nalalaman ng mga studies natin? Nalalaman ng mga studies ng all over the world. Not because you have been afflicted by the COVID-19, but because you are affected by the pandemic, no, the situation itself, yung sinabi kong sources of distress. Because remember, yun yung kailangan natin matandaan, no? Lahat ng mental health disorder starts with a simple stress. If you recognize if you recognize these symptoms in the early onset of stress, most likely you will do certain things in order to manage that stress. Inherently, even without a psychologist. Nagtatanim ka ng mga pots, planting, di ba? Inaaway mo yung husband mo, okay rin yan. Sometimes, ha? Oo. Coping din yan. No? Kinakausap mo yung mga halaman mo, okay din yan. It creates, if it creates a healthy way of coping, why not? Because the idea there is that you manage your stress well. Kaso ito naman, no? And this is really very true, no? Specifically among teachers. Sasabihin natin, ay, stress lang yan. Itong simple stress, once it will become accumulated, cascading siya. Meaning to say, it's quite deceptive. You will not know the effect, the severity of the effect of stress Not until such time that you suffer already from a mental health disorder. Diba? That's why I was once a speaker ng mga regional directors, no, here in Northern Mindanao. And a regional director, you know, shared to me, no, sabi niya, alam mo, Doc, totoo yung sinabi mo sa stress. Kasi, di ba, lalo na yung mga supervisors, lalo na yung mga teachers, mga administrators, no? Di ba, pag administrator ka, kahit ilaw ng office mo, kailangan mo talagang i-monitor, baka hindi na off nung pag umalis ka na sa office. I mean, these are really truths, no? Sabi ng isang regional director, hindi ko lang babanggitin kasi medyo very personal, no? Sabi niya, alam mo sir, one time, yun, yung husband niya, nag-demand sa kanya na they have to have their personal time. And she's already a regional director. And the husband was also there, no? And, naku, ito na. Nag-start na sila ng, you know, intimacy, couple intimacy. Alam mo na yun, anong ibig sabihin nun, right? And they were already on the act of their intimate activity. Suddenly, yung babae na regional director, sabi niya sa akin, alam mo sir, at the middle, no, of that intimacy, sabi niya, stop muna. Yung lalaki na siya, yung husband na siya. Bakit? Kasi parang nalimutan ko baka hindi lock yung office. Can you imagine that? No? At the middle of, you know, the intimate activity, nag-stop kasi baka hindi daw na-lock yung office. Yung lalaki, hindi naman sila mga young ones. Di ba? Yung lalaki, yung momentum, biglang huminto. Alam mo naman, pag may edad na, di ba? Kailangan ng momentum na medyo mahaba-haba. Wala. No? And she was actually sharing this to me, no, in a personal note. And she was said, sir, you know what? I could really agree with the idea that, you know, some disorders are coming from simple stress. And we knew that in clinical psychology. We knew that in mental health research that we had for a number of years already. So pag stress, huwag mo sabihin, stress lang yan. No? Because the complication of stress, once it is accumulated, sabi ko nga, deceptive. Because the effect is cascading. Creeping siya, cascading, then after which, you will just realize, wow, andito na yung mga mental health disorders. And the pandemic-related disorders can be cascading also. That it creates psychological disorders. No? What are the disorders according to studies? Number one, post-traumatic stress disorder. What is post-traumatic stress disorder? Ito yung event, one of the features here, and cardinal feature of PTSD, is actually what we call as intrusion. Yung, shall we say there is a big fight in the family. Pagkatapos niyan, you become even if you don't like it, but the memory keeps on intruding your thoughts. No? As if you are living that memory day to day as if it is happening again now. No? We call that post-traumatic stress. Like another example, sa pandemic-related distress based on my client, no, para hindi naman academic masyado. For example, ito, yung fear ba na mahawaan, nakakita siya ng kaibigan niya na na-afflicted ng COVID-19. Alam mo anong nasa isip niya? Kasi nag-usap sila online. It keeps on intruding yung health status ng friend niya and the sacrifices ng friend niya to a point na affected siya masyado na nag-i-intrude na, nag-dream na siya na siya na yung mayroong COVID-19. No? And it became so distressing to a point that it creates what we call as post-traumatic stress symptoms. Another disorder is what we call anxiety. Ano yung anxiety? And I will discuss that later. Yun bang generalized anxiety? Nung una, takot ka lang sa COVID-19. Right? That's specific anxiety. Kasi nahawaan yung governor, nahawaan yung drivers. For example lang itakot ka magka-transmit or mahawaan ka ng COVID-19. Sooner or later, hindi mo nabantayan, takot ka na sa lahat. The anxiety becomes generalized. Takot ka na anong mangyari sa buhay mo. It's no longer about COVID-19. but related to COVID-19, but no longer directly related to the fear of being afflicted. Takot ka na kung anong mangyari sa anak mo. Takot ka if your children will get married. No? Takot ka if baka yung mga halaman mo baka mamamatay. So these are anxiety, generalized anxiety. Started from COVID, but it was actually, you are not aware of that, and then you become fearful and anxious to every area in your life. Okay? Another one is depression, the sense of hopelessness. We will discuss that later. And most common pandemic-related stress is what we call stress. You know, as what I have said, stress is very important because if it is creeping, it is cascading, and there is a guarantee that it will always be progressive. Without managing stress, good luck. Sino ba dito ang walang stress? No, I could not see. But anyway, if you raise your hand and you said you haven't experienced stress at all, congratulations, because you are an exception to human race. Diba? O sige. Now, another disorder, according to literature, is what we call affective psychosis or brief psychosis. Ano yung brief psychosis? Para yung may mga documented cases na kasi na ang they are becoming, you know, they have hallucination. No? May nakikita sila na wala naman diyan. No? Meron silang mga delusion that God sent them a message that they will become a great teacher and they could not be afflicted by COVID. No? So mga delusion na. May naririnig sila, giving them instruction. But these are actually very brief. No? Kasi nawawala din. Sometimes bumabalik, sometimes nawawala. No? And this is actually a very serious disorder. No? Another one, another mental health disorder is burnout. Now, according to studies, you know, burnout, the number one feature ng burnout dyan is what? Emotional exhaustion and lower sense of personal accomplishment. Ano yung exhaustion? Parang pagod ka na, no? And sometimes you feel that you are so busy and you feel that you are working very hard, but you are busy doing nothing. Why? Because you kept on thinking that you are busy and you are preoccupied by the thought that you are busy. No? And it exhausts basically your emotions. And then you feel that your personal accomplishment, your productivity is no longer, you know, there before, unlike before. No? So that is also burnout. Another disorder in which actually I've been roaming around the Philippines before I went for my international post as a professor in Catholic University of Portugal. I roam around the Philippines for, I mean, that was, you know, the roaming around the Philippines, you know, looking or examining or investigating the after effect or aftermath of disasters. That was long before the MHPSS, if you are aware of that, long before the MHPSS were there. No? So I've been roaming around the Philippines, 17 regions. No? And I could really see somatic symptom disorder. Why? Ano ba yung lugar sa Pilipinas na walang liniment? Walay haplas? Wala. All over 17 regions in the Philippines, no matter what is your religion, no matter what is culture, meron talaga yung haplas. Di ba? Kung walang, merong omega painkiller. Kung walang omega painkiller, may efficacent. Kung walang efficacent, meron pang, ano yun? Ang dami. Sa radyo nga, ang dami eh. No? Because, sumasakit yung katawan natin. But if you go to the doctor would say, negative man. Wala ka namang sakit. Pero doc, kasi masakit yung shoulders ko, masakit yung ulo ko, parang merong umaalis dito na part. Eh, sumasakit yung balakang ko. O, ang daming sakit, di ba? And most of that, without any organic cause. So, anong ginagawa natin? Usually, we indulge in massage. Hilot. No? Kung walang drugstore na dyan sa medyo far-flung areas na, ay, gaas yan. Di ba? Tuba-tuba. Kung wala, gaas. Kung wala, cooking oil. Kung wala, kahit ano. Basta may haplas. Right? So, I mean, that is true all over the Philippines. I could really, I am really a witness of that. No, roaming around the Philippines, kahit andun ka sa Cordillera, kahit andun ka as far as Lanao del Sur, or you can go here in Surigao, kahit ay lalo na dyan sa San Jose, yung isla dyan, oh, Surigao del Sur, ang dami dyan, right? And most of the time, I could not imagine a life without haplas, you know, a life without hilot. Oh. And these are indicators of somatic symptom disorder when there are bodily pains without known organic cause. Okay? Another one is irrational fears. Ano yung irrational fears? Irrational fears ay yung kabag, no? Meaning to say, nahadlok ka, pero kung pangutan-on ka nganong nahadlok ka, wala ka kabalo. Hadlok lagi ko ron. Pangutan-on, nganong nahadlok man ka? Ay ambot ngano. No? A lot of teachers have that, right? Oh, nakulbaan lang ko kalit. Nganong nakulbaan man ka? Wa ko kabalo. Oh, giingnon na hala, basing naiingkanto diha sa kilid-kilid. Mao na diha. No, irrational fears is also a manifestation of mental health disorder. Okay? So another one is maladaptive binge watching. Oh, ako nagbi-binge watch ako ng mga Netflix series yung mga anak ko, no? Now how can you say that that is maladaptive already? If you no longer sleep, if you feel fatigue, if you could no longer control watching Korean novelas or watching whatever is there to watch, and you will binge watch without sleeping already, then that is the time that you will say that you already are in a maladaptive binge watching. O di ba? And that is also related to pandemic distress. Kasi hindi naman we are encouraged to stay at home. Ano bang gagawin natin sa bahay? Mostly we watch TV. Di ba? That's why ang daming nagpo-protesta nung nag-close yung ABS-CBN. Why? Kasi nagbi-binge watch ang iba sa ABS. Ngayon sa GMA meron din, right? Kung may cable ka, lalo na. Kung may online signal ka at saka nagwa-watch ka ng Netflix or Amazon Prime, ay lalo na hindi ka na natutulog niyan. No? So maladaptive binge watching, you no longer eat, you no longer sleep, or lack na lang ang sleep because of the fact that you kept on watching shows. That is an indicator of mental health disorder also, no? Due to the pandemic-related stress. Another one is, which is actually very important because we have studies here about poor sleep quality. Why is that this is very important? Kasi sleeping disturbance, and we all knew this in the mental health profession, sleeping disturbance is a gateway of all other disorders. Pag hindi ka nakakatulog, be very cautious and make ways, cope effectively for you to have proper sleep. Why? Because if you have poor sleeping quality or if you have sleeping disturbances, most likely, lahat ng mga mental health disorders na binanggit ko, you will be prone to have that. Kasi ito yung talagang indicator na ng pinaka-basic indicator ng mental health. No? Pag hindi ka na nakakatulog or you felt that you have slept for 12 hours, and when somebody asks you, oh, you slept well, and then you said, no, I feel that I lack sleep. O yun, that's already poor sleeping quality. No? So we have to be very cautious, and we have to be even the things, even the food or the drinks that we usually take in, okay? Because that is also a disorder. Another one is obsessive compulsive disorder. So washing hands is no longer considered. Repetitive washing of hands is no longer considered obsessive compulsive disorder because pandemic situation is here. What do you mean by obsessive compulsive disorder? Yung mga may ritual talaga na they felt that the day is insufficient, that the day is lacking because they have not done their rituals. No? So for example, meron akong teacher before sa high school, no? na talagang galit na galit siya pag yung mga frame sa rooms hindi balance. No? Pag may mga ganun-ganun na, galit na siya niyan, nai-irritate siya. Kailangan balance talaga. Eh di ba sa uso natin yan before, may hanggang ngayon yata may mga sweepers. Pinapagalitan niya yung mga sweepers. Kasi bakit hindi balance yung mga frame? O di ba? Ang saya-saya ni Ma'am, no? Baka meron kayo niyan, no? Oo. Hindi lang natin alam. Yung mga rug, yung mga map, yung mga ina-arrange natin diyan. Kailangan color green lahat. O, di ba? Pag may blue, nagagalit yan, nai-irritate ka. Kailangan green lahat. Eh kung pink lahat, kailangan pink lahat. Wow, si Ma'am naman, no? Okay, so yun yung mga obsessive compulsive disorder. You know, it gives them a sense of stability despite the fact that there is pandemic. So lalo na silang magre-ritualized behavior because of the disturbance in the environment due to the pandemic, no? Another one is vicarious traumatization, and this is very true. When you see people who are traumatized, sooner or later, because of your empathy, you will also feel traumatized. And this is specifically true to teachers. Lalo na pag na-witness mo yung mga students mo na they are traumatized due to the fact that they are really having difficulty with this pandemic. The loss of the jobs, no, the loss of jobs rather of their parents, you know, and it creates disturbance and difficulty among students. Eh, ikaw naawa ka sa students. Sooner or later, this is actually the mechanism, no? Sooner or later, dahil sa awa, syempre, no, natural natin yan. Principles of teaching, kailangan you understand your students well, not only about the lessons, but the person, no? That is embedded in our profession as teachers. Eh, itong awa natin, pagbigyan natin ng awa or empathy, yung symptoms ng trauma nila, sooner or later, we will feel them. And even if you are not the one responsible or if you are not the one experiencing the trauma events in their lives, you feel that it is now your experience because of your empathy to your students. Now, that is what we call vicarious traumatization. And this is also true, suicide. No? In this part of Mindanao, we have last year around 2 or 3 young teachers who committed suicide. No? That's why the Deped Iligan communicated to me to provide intervention for stress management. No? Why? Because yung mga young teachers are very vulnerable, no, for suicide, no, and it's really a sad story. I am not expecting. I hope that I am wrong, but you know, because of the pandemic-related stress plus the stress at work, no, I hope that hindi naman ito tataas because global prevalence of suicide are increasing due to the pandemic. That's known to us, research scientists, that really suicide is increasing nowadays. In fact, MSU IIT, we have had a number of meetings because we are expecting, no, that suicide will increase. You know, MSU IIT is very noted for students who will commit suicide. But for the last 2 years, wala kaming suicide because we created a program. No, I started helping MSU Monday. A lot of coaches, no, sports coaches, said this, no, sir, yung mga athletes namin, talagang they experience sense of derailment. mental health disorder, but it has been whether we like it or not, the reality somehow indirectly reinforces problematic internet use. Or events in life with the context of the, or rather in the context of pandemic related stress, is actually somehow gives you a sense that you don't to utilize smartphone use, no? Ito, I wanted to emphasize this. Meron tayong mental health disorders na very apparent among teachers. That's why I included this, and I provided here potential mental health consequences because wala pang studies specific to teachers. Ang number one yan is secondary traumatic stress. Ano yung secondary traumatic stress? It's a joint, actually, disorder. It's a disorder like post-traumatic stress disorder and vicarious traumatization. You did not experience, like vicarious traumatization, you did not experience a trauma. But witnessing friends, colleagues, relatives suffering from so much distress due to the pandemic, without any deliberate effort, you will be experiencing symptoms of post-traumatic stress disorder. Now, why is it that this is special to teachers? Kasi, although we are not frontliners, we are essential workers. Meaning to say, every day we interact with people. And we knew that teaching is empathy. Kahit strict ka pa, kahit wala kang pakialam, the moment you teach, you are empathizing your students. And the more you empathize students, the more you will become vulnerable to secondary traumatic stress. No? And this is actually real. No? We have a study right now ongoing pa. We don't have yet the results. What is compassion fatigue? Di ba, ang mga teachers, inherent in our teaching profession is we are compassionate. Naaawa talaga tayo sa mga students natin. Naaawa tayo sa iba. Because part of our vocation in teaching is to be compassionate. Kaso, if you are overwhelmed by the pandemic-related distress, yung satiety point, yung breaking point sa pagiging compassionate, talagang magre-reach dyan. Now, what will happen if you have compassion fatigue? You will no longer feel compassionate to your students. You feel compassionate sa ulo na lang. I mean, your thoughts, yes, you are compassionate. But the way you express and share and understand emotions of students and colleagues are no longer there. Nakafatigue ka na, na-reach mo na yung fatigue of being compassionate. And that is really alarming for teachers. Di ba? Among doctors, this is given. In fact, this is their problem. I was giving a talk before in Manila, attended by several doctors in Makati Med and all other prime hospitals, premier hospitals rather. And they accepted this. They don't mention the names of their patients. They mention only the numbers. Patient 101. Why? Because they reach a point where they are no longer feeling the compassion towards their patients. And same as with teachers. I dare you, alam natin na marami sa atin ang nagkaganyan. In our thoughts, yes, we are compassionate, but the way we feel, parang wala nang pakialam sa students. Right? And this is just a forewarning. May mga teachers dyan na nagbibigay ng mga assignment, nakatakot-takot na assignment. Why? Because they just don't feel the students anymore. And that is a mental health disorder. And that is what we call compassion fatigue. And if not, addressed, compassion fatigue will turn into burnout. No? And if burnout comes in, then you will have other disorders already. Okay? Now, I might be talking here without figures, but of course, I delete some end notes. As a researcher, I don't want to bore you with data. Okay? But let me give some data na lang, no? Prevalence of mental health in United States. Before, 6.6%. That's already high in United States. Now, it's 24.9%. Ang depression. Ang anxiety, 8.2% nung una, mataas na yan sa US. Ngayon, 29.4%. Meaning to say, 1 out of 3 are experiencing anxiety disorder. 1 out of 4 nag-experience ng depression. This is threatening. No? This is already threatening. I mean, if the statistics there, this is most recent statistics that they have, no? How about, kasi Western yung US eh. How about Asian? In China, much more. Generalized anxiety disorder is around 30%, right? Teka muna. 35.1%. That is basically the generalized anxiety disorder. And then, depressive symptom, 20.1%. Poor sleep quality, 18.2%. So 1 of 5 are depressed in China. In a way, if the estimation is correct, generalized anxiety is around 35%, and poor sleep quality is 18%. Before, in the initial stages of this lecture, I told you some data, right? If the population is already suffering, no? The proportion of the population is 8 to 12%. If they are already suffering from a certain disorder, that is already an epidemic, right? Now, for some old school of thought in epidemiology, 5% of the population that can be considered already epidemic. Now, can you imagine 35%? That's more than an estimated of 12%. That is epidemic already. No? That's why it's a crisis within the crisis, even in China, even in United States. Now, how about those who are in the medical profession? Much more. Anxiety, 23. 1 out of 4. PTSD is around 27%. So 1 out of 3 or 1 out of 4. Okay? So that's for medical professionals, no? How about college students? Generalized anxiety of college students, 24.9%, meaning to say 1 out of 4. Okay? How about post-traumatic stress disorder with those who were afflicted by COVID-19? In China, PTSD of those who are afflicted by COVID-19, they suffer from PTSD 96.2%. It's like 1:1, right? It's like if you have afflicted with COVID-19, most likely you will also experience post-traumatic stress disorder. And that is very threatening, because it requires already medication. How about in the Philippines? Do we have statistics in the Philippines? So far, none published. But I have some because our studies are ongoing. How about in the Philippines? No, we assess teachers in Region 10, 1,110. But these are college teachers, no? In Region 10. You are in Caraga region, no? But anyway, we will talk about that. Now, with regard to major depression, can you imagine sa mga teachers sa Region 10, sa college teachers, 28.38% are suffering from depression. Provisional diagnosis to, ah. So meaning to say 1 out of 3 or 1 out of 4 are suffering from depression sa mga teachers. Generalized anxiety, 17%. It's beyond 12%. How about psychological distress? Yung clinical psychological distress, 55.59%. Siyempre, expected yan. Ang dami nating distress as teachers. No? Region 10 to last month, actually, because Chad invited me to talk also about mental health. No? And then somatic symptom, yung sabi ko kanina, it's 17.57%. So, medyo mataas na siya, far from the 12%. But it's really threatening ang psychological distress because remember, ano yung sabi ko? If psychological distress could not be, intervened, it will result into other disorders. No? So, likely, for teachers in Region 10, around 55.59% are likely to experience certain disorders if not mitigated by certain interventions. That's why the awareness itself about these statistics, according to research, is already important in our mental health. No, to be aware of this, that these are real things. And now, how about those counselors? Because I was also invited by a group of counselors here in Mindanao, Region 10, about the same, promoting mental health. 1 out of 5 counselors, guidance counselors, or helping professionals are already suffering from depression. 1 out of 5 are suffering from generalized anxiety, and around 41.28%, 1 out of 3 or 1 out of 2 to 1 out of 3 are already suffering from psychological distress. So meaning to say, lahat yata nagsuffer ng psychological distress. How about HR practitioners? Because I was also invited. No, the scales here are validated, no, because I studied this and I published all the scales here, and they are also being utilized in China. They are utilized by World Health Organization, so we have some sense of comparability with regard to prevalence. Psychological distress, 43% among HR practitioners. Generalized anxiety, 14.5, 16.9% for depression. How about, sorry. How about, from Philippine Science High. Mataas ang psychological distress, that not that much. But major depression and general anxiety, above pa rin, no? This is from Philippine Science High. In fact, they are supposed not to have this prevalence, no? Because Philippine Science High, although their training is rigorous, but they have limited students, no? So anyway, I am also a consultant of Philippine Science High here in this part of Mindanao, no? But not in Caraga, no? I really love to lecture faculty also coming from Caraga, no? Because I was born there, no? I was born in Butuan City. Anyway, last Monday, we have already the statistics. Mental health prevalence of coaches, trainers, and PE teachers. The N is 551. 25% are suffering from provisional diagnosis of depression. So meaning to say 1 out of 4. Generalized anxiety, 1 out of 5. Psychological distress, 4.28%. Allah, di ba? Ang laki. So 1 out of 2. No? Somatic symptoms, 1 out of 5. Now, how about the participants of this seminar? Tingnan nga natin. Mitch.
Sir, can you end your slide so that I can present?
I will stop sharing first, no?
Yes, sir.
Okay. So we have already, ilang bang N yan, Mitch? The number of those who answered?
1,610, sir.
Okay, gusto ko yan. Tingnan natin yung prevalence ng mental health natin dito, no? So I'll stop sharing muna, no? Okay. So Mitch, go ahead with our statistics. I'm excited and worried. Oh, ito na. Oh, for those who attended in the seminar, major depression, provisional lang to ha, hindi naman to full diagnosis. 24.16%. Meaning to say, 1 out of 4. Generalized anxiety, 18.63%, 1 out of 5. Psychological distress, my God, no? 52.17%. Kailangan nyo talagang mag-cope effectively with distress. But to be honest, I understand. No, I understand why we have almost more than not almost but more than half of those who are attending here have reached to the cut-off score of clinical psychological distress. And I understand that. You know, with this pandemic-related distress, abnormal reaction coming from an abnormal situation is actually normal. No? And as of the moment, I guess the takeaway of these statistics, you know, although it's saddening, but the takeaway here is that, you know, don't worry that much because it's still in psychological distress. If you can manage that well, it will not turn into disorder. Although I am very much sad to say that 1 out of 4 are already having provisional diagnosis of depression. And somatic symptoms is 1 out of 5. You know? Oo. Di ba? Talagang earning ang mga drug companies natin na nagsisell ng mga efficacent oil at saka omega painkiller and other liniments. Kasi 1 out of 1,000 plus respondents are actually buying those, no? Probably. Um, if 52.7%. Now, okay. So, Mitch, I'll go now to my presentation again. Saan ba yun? Okay. Sorry. Uh-huh. Let's compare ha. Let's compare sa ibang statistics natin dito sa sa Region 10. No. Mitch, please turn on your mic ha because I might forget the statistics.
Yes, sir.
Sa ano yung prevalence ng major depression nga?
24.16%, sir.
24.16%. Oh, di ba? Mas a little bit lower kayo dyan sa Region 10. O siguro, mas distressed ang teachers ng Region 10. Generalized anxiety.
18.63%, sir.
Mas anxious kayo kaysa mga Region 10 teachers. Psychological distress, pero it won't matter, no? The same.
52.
Yes, psychological distress, 52%. It does not matter because the difference is very minimal. Somatic symptoms,
21.8.
ay yan, oo. So maraming nagpapahiglot siguro dyan. Okay. Okay. So, di ba, it is a little bit bothersome, no? So there are 3 takeaways, no? Before I will have a brief break to determine if you have some questions. For a while. There are takeaways. Like, what do we mean by these statistics? Number 1, the psychological distress is very high. That is my fear. Because of course, I understand Deped. If Deped now will give you trainings about how to conduct psychological first aid, and you yourself is experiencing psychological distress, how can you take that? It means that conducting psychological first aid to our students becomes a burden, additional burden to teachers. That's why we need to understand first ourselves, how we are reacting, or how are we responding rather to the pandemic, before we will understand how to deal with our students with regard to the pandemic situation. No? Because, you know, it's always like we have to understand also ourselves first, right? Because without understanding ourselves first and how we respond to this pandemic related distress, we are also victims. Unlike any ordinary disasters, and I have to tell you this, conducting psychological first aid or conducting crisis management or crisis, we call that debriefing, may likely be effective because of the fact that the one who will be giving the training and conducting these interventions are not affected by the disasters. Probably, they have to understand first, no? Now, tayo lahat ang affected dito eh. Di ba? And based from statistics, and this is not just, a blah blah. This is not a fiction. It is factual. You have answered the scale. More than half of you here